I'm Mary Yates. I'm a nurse consultant for health promotion and wellbeing. I work at South London and Maudsley NHS Foundation Trust. Smokers are not difficult to find. They're hiding in plain sight. They are outside our hospitals. They're in our hospitals. 1/3 of all the people admitted to acute hospitals today and every day have got a smoking-related illness. So smokers are in our hospitals. The development of the smoke-free policy here has taken many years, and I would say we are still on our smoke-free journey. When I first started talking to the patients here in our hospital, I found that 23% of them had started to smoke when they arrived here as a patient. One of the first challenges was about the lack of knowledge and lack of confidence. So what we did was develop an e-learning program together with colleagues from King's College University, and this became a mandatory and accessible training program, which gave everybody a basic set of knowledge and skills and information about what they were expected to do. We really listened to patients. We began to try to learn quite a lot about tobacco dependence and how we could help to alleviate these challenges that people with serious mental health problems had who were smoking, and started to educate the staff to understand, to recognize nicotine withdrawal symptoms, to stop confusing nicotine withdrawal symptoms from common mental health problems. And we started to make available the tobacco dependence treatments here within our hospital and our services. And then, of course, we developed the policy, and we did that in a collaborative way with service users, carers and staff at different levels in the organisation. And we had a communication strategy for trying to explain to people what steps they needed to take and how they needed to incorporate this new treatment. The most important thing is that the patients understand we are implementing the smoke-free policy because we care very much about them. We care about their recovery. We care about their opportunities that they can have to live as well as everyone else in this community and for as long as everybody else. Staff need to understand that tobacco dependence, it's an urgent clinical condition. And a bit like looking after somebody who's got diabetes. If we had a diabetic patient, we'd be monitoring their blood sugar level. When we have a smoker in our care, we start monitoring their carbon monoxide level. Once you start doing that and you incorporate that into your routine clinical practice, the conversations you have with patients completely change. And you start to talk to people about how they can start to control that carbon monoxide level, how they can get back in charge of their life. And they really begin to feel like suddenly things are possible to change. We have, since 2012, supported and encouraged people to use e-cigarettes here. Because e-cigarettes are not licensed medicines, we do not prescribe them, but we support everyone to use them if that's what they choose to do. We always recommend the licensed medicines first, nicotine replacement products, varenicline or bupropion, and if the smoker doesn't wish to use these or they've used them and found them unhelpful, we steer them and support them towards using an e-cigarette. Of course, not all people with serious mental health problems can manage the different types of e-cigarettes. So we try to have an individualized, personal approach to supporting e-cigarette use. And it's very, very successful. We have been thrilled at how many people have been able to quit and then titrate down to zero and even to stop using e-cigarettes altogether. The most important thing about an e-cigarette policy is that you've got to think about what's affordable and accessible to that smoker. I support people commonly in the community to establish themselves on an e-cigarette that they can buy close to their home. It's about what's available locally and what suits each individual. Some people, like the e-cigarettes produce a lot of vapor. Others like something that's very discreet. For me, I think the most important thing is that we look at what each individual needs, and we find something that matches their needs and that they enjoy. All of the efforts that I now make in my work are to create spaces where people can engage in healthy pursuits. So Parkrun is a great example of that, and it's been thrilling. We've had roughly 100 runners every week since we started. People from all ages, all walks of life, breaking down stigma, people with mental health problems, people with physical health problems, coming together. But we have many, many other things that we're developing now, like outdoor gym facilities. As you can see here at Lambeth Hospital today, we've got wellbeing events, we've dance classes, pat dog, stress management workshops. We're making smoothies from using bikes. We're doing so many different things. And I'm so excited because I think the future of the NHS is all about supporting people to live well. It's about self-management. It's about making these opportunities available. So when people come to hospital, they're able to experience and test out all of these evidence-based treatments and these opportunities for living well for longer.